Jackson. It's good to see you again.
Hi.
So, let's see. I want to go ahead first and get your name and date of birth.
Jackson Renani.
Okay. And what was your date of birth?
April 5th, 2000.
Okay. So we were able to run some tests because of the nausea and vomiting that you've had, and it turns out that your appendix is swollen and infected. So fortunately, catching this in time is going to let us be prepared to get you your surgery tomorrow. Okay?
Okay, sounds good.
All right. So I'm just going to go over a couple of things that you need to do to prep for this. First is going to be to not eat or drink anything 8 hours before.
Okay.
Okay. And then we're going to be giving you an antibiotic that you're going to need to pick up after you leave here. That's going to help with the infection that you already have, and it will help prevent infection from after the surgery. Okay. Do you have any allergies or sensitivities?
No, I do not.
How about a history of bleeding?
Well, if you count nosebleeds, then yes, but other than that, no.
Oh, ha ha. Okay, so I want to go over the surgery with you, but first let's make sure that you have everything in line for support for this procedure, okay?
Okay.
All right, so because you'll be under general anesthesia, which means you'll be asleep, you're going to need a ride home because this is going to make you drowsy for a few hours. Do you have somebody that can take you home?
Yes, I have my parents.
Okay, are they going to be coming with you?
Yes, they should be.
Oh, great. So when they come in, we'll be able to go back over all of these things so that they know what to expect as well. Does that sound good?
Yeah, sounds good.
Okay, so I really need to go over these few things with you. And if you have any questions while I'm explaining, please feel free to stop me and ask, okay?
Okay.
Okay, so I'm going to have you sign this consent, and it's just going to list all of these things that I'm going to go over, okay?
Okay.
Okay, so the procedure that you're having done is a laparoscopic appendectomy. And really, that's just a fancy word for a camera that the doctor's going to insert through 2 small incisions in your abdomen. It's going to have a camera on it. Once the doctor puts the small tube into your abdomen, he's going to fill it up with gas, and he'll be able to see your appendix. Once the camera shows the surgeon where to guide the instruments, he's going to find the appendix, tie it off with stitches, remove it. The small incisions are then cleaned, closed, and dressed. Okay?
Okay.
So this is a much more simple procedure than they used to do, which was just an open incision. So this is how you're able to have a shorter recovery time, which is going to be about 6 weeks. Okay, so after you come out of your anesthesia, we're going to keep an eye on you for just a few hours. We'll make sure that your vital signs are good and make sure that you don't have any adverse reactions, okay?
Okay.
All right, do you have any questions so far?
No, everything seems to be good.
Okay, so a few days after, you could have some pain, and that's going to be normal. The doctor is going to give you some medication to help with that pain. And like I said, you'll continue to take those antibiotics that the doctor's giving you today. You want to make sure that you keep the incision clean. And you're going to look for some signs like redness or swelling, a high fever above 101 degrees, chills, vomiting more severe than you've had over the last few days, a loss of appetite, stomach cramps, or diarrhea or constipation that lasts more than a few days. Okay?
Okay.
So even though there is a small risk of further infection, most people recover perfectly fine, but I still need you to know that there are some risks that come along with this surgery, okay? Those risks are bleeding, injury to nearby organs, or a blocked bowel. Your alternatives are to go ahead and leave this untreated, but unfortunately, without this surgery, it can cause a much more serious infection or for the appendix to burst. And both of these things would end up resulting in an emergency surgery anyways. So you can see that this option is less severe. Okay?
Okay. Would this be fatal to my life in any way?
There is always a small risk with any surgery. Adverse reactions to anesthesia can happen. Have you ever been under anesthesia before?
I have not.
Okay, so we'll make sure that your anesthesiologist goes back over any further risks with you. And this is also a question that I can convey to the doctor for you. Okay?
Okay.
Okay, so there is going to be some pain after, so you're going to want to limit your activity. And other than that, you can return to your normal activities within 2 weeks. All right?
Okay.
Okay, so I just want to make sure that you understand everything that we've gone over.
It's making sense.
Okay, and I'm going to give you this other paper that has the clinic number and our after hours number, just in case you have any of the symptoms we listed. And I'm going to go ahead and call and check on you the day after your surgery, okay?
Okay.
All right, and we'll set up your follow-up appointment with doctor for 2 weeks from now. And I'm going to go ahead and send in our office manager so that she can go over finances with you and your cost and insurance. Okay? All right. Good to see you again, Jackson.
Thank you.
Take care.